So let's talk about embryo transfer, all right? So, and I'm going to lay out some realities here, and then, and I made the comment yesterday, when we finish this today, I'm not going to provide you any silver bullets that are going to fix some of the issues that we have in ET right now, but I'm going to provide you things to think about and things to consider. So obviously, embryo transfer has been around for a very long time. Vitor, the computer's not working now. Click on it again. Okay, there we go. So obviously, embryo transfer has been around for a very long time. International Embryo Transfer Society just celebrated 50 years. We've been commercially producing embryos since the 70s and into the 80s. First, the IVF human baby was born in 1978. The point that I'm making is this is not an immature technology anymore. Okay, there's a lot of maturity to it. There's a lot of people around the world that work specifically in the area of increasing the efficiencies to embryo transfer. If we look at the global trends, in vitro fertilization or in vitro produced embryos have drastically outpaced multiple follicle ovulations. And that's been driven by a number of factors that I'm not going to go into, but these trends, and this is only reported data that comes into International Embryo Transfer Society. So there's a lot of data that's not reported. So people always look at these numbers and say, well, these are quite low. The point is there's a lot of in vitro fertilized embryos made around the world, all right, and they're far outpacing multiple follicle ovulations, and that's even true in the United States. So to set the floor for what I want to talk about, I first want to talk about what is perceived to be normal. Okay, what does normal pregnancy look like? What does normal pregnancy loss look like? And then how far off are we in these ET programs? I'm sure some of you have seen this picture. I tend to show it everywhere. This is a 3D, 4D ultrasound of a day 65 bovine fetus. Really nice, tucked in the uterus there. You can see the placenta wrapped around it. Sort of gives us this really nice image, and this is what we're trying to get to, okay? Once we get to about this time in gestation, we're relatively safe for most cases to make it to the end of gestation, except in vitro fertilized embryos, which I'll talk about at the end. So what does normal pregnancy look like? What basically has to happen is the embryo goes from a circle, elongates, and attaches to the uterus in a very complex mechanism, with what these pictures show here. I'm just going to show you this. This is two cross sections of the uterus, okay? I don't want you to take anything away from this except if you look on the left, it's day 21. If you look on the right, it's day 31. And if you just look for the green, you can see there's a lot of changes happening in just 10 days, right? So the pregnancy changes quite rapidly early in gestation. In the most turbulent times of these pregnancy changes, when we're having all this remodeling, when we're having all this attachment, is the highest chance to undergo pregnancy loss. All right, and that's basically what this image is showing here. You have this complete remodeling of the uterus. You have the pregnancy that starts to establish itself. So I had a graduate student a number of years ago, Sydney Reese, who now works for Prime Pursuits and 44 Farms. She came to my office one day and she said, we don't have any data of what normal pregnancy loss is in beef cows. And I said, well, that's this figure. Is this mic cutting in and out, or is it just me? Vitor, you gave me a faulty mic here. Okay. So I said, yeah, sure, I have this slide that shows what that is. And she said, yeah, but I looked for the reference on that slide, and that reference doesn't exist. So for my entire graduate career, I was showing this data that there was no reference for, and so she went out and said, okay, I'll figure out what it is. And what she did is she did this very large meta-analysis to basically determine how much pregnancy loss occurs at different stages of gestation, okay? And for terms today, what we call early embryonic loss is pregnancy loss that happened in the first 28 days of gestation. And pregnancy loss after that we call late embryonic or early fetal loss. Okay, so we're breaking it down basically before day 28 when you do a pregnancy diagnosis, between 28 and 31, and then after that, all right? And so she sorted all through the literature. She had this stack of papers and would bring them to my office. I mean, a year's worth of work trying to get everything out of the literature, all the way back into about 1978, 1980, the time that ultrasound started to come on, that we had early pregnancy diagnosis, etc. And so what it boils down to is this is showing loss in the first 7 days of gestation, which is very difficult to pin down because you have to basically harvest the tracts of the cows, you have to flush them out, etc. And I just want to say that yes, there is a fair amount of loss that happens in the first 7 days, and I think we still struggle with how much that is. This is the range of 12 different studies up here showing that the loss on average is anywhere between 9% and 40%. All right? Now what we're going to do is cumulatively carry this forward, and we're going to say, okay, what's the amount of early embryonic mortality that occurs, the amount of loss that occurs in the first 30 days of gestation? And so the way that this is done is we have these moderators. So we have parity, nulliparous, primiparous, multiparous, we have Boston-Kiss, Bos-Taurus, and then we have the type of reproductive technology that was used. This is showing the amount of pregnancy loss. So for example, Bos-Indicus cows on average have 50% pregnancy loss in the first 30 days compared to Bos-Taurus cows at 44%. On average, across all these that we looked at, over about 50,000 diagnostic records, the average pregnancy loss in the first 30 days of gestation was 47%. All right, if you struggled in math like I did, I'll do it for you here. We basically ask the question, what's the pregnancy rate? So we do 100% minus the pregnancy loss that I just showed you. So on average, if I go into a group of primiparous cows and use some level of reproductive technology, on average, my realistic expectation based on our data would suggest that the pregnancy rate at day 30 is 45%. Okay? If you look in Bos-Indicus, you can see the differences in Bos-Indicus and Bos-Taurus there. You can see the differences across these different technologies here. If we move forward and we say, okay, what about this next period of loss, which is a period of loss that we're really interested in after you can confirm a pregnancy, but then you come back and you do a pregnancy check at day 60 to day 100 of gestation, how much loss occurs after that? Same type of breakdown. I'm just going to flip forward here and show you, here's the expected pregnancy rates at day 100 of gestation, including all the loss into that point. So if I go back into that same set of primiparous cows, I track them forward. On average, for a day 100 pregnancy check, I can expect 40% of them to still be pregnant from that single ovulation, NAI, or single embryo transfer. So the point is that in a normal, all these are normal animals. Disease-free, have everything, got pregnant, etc. All ovulated to the protocols, etc. So what is normal pregnancy loss? This is what we're normally looking at. All right? And yesterday for the panel, when I brought up what are realistic expectations, a lot of times we project those based on what we see as normal. So, I tell people, what can you expect from an AI protocol? 50%. If you get better than that, great. If you're in primiparous cows that are in poor body condition score, etc., you can see how you're going to dip below that. So it's important to know what normal is. So as we look into these more advanced technologies, how do we deviate away from that, right? And what comes into play? So this is the paper. If anybody wants to look it up, this is the more complicated graph that Sydney made for that. So basically what we're interested in is why when we transfer an embryo, or why when a cow gets pregnant, why doesn't she always go on to have a calf? Even when we can detect a heartbeat and we see it there, etc., versus why do sometimes they lose those pregnancies? And obviously, as you increase the level of technology you're using, the expense also goes up. So you're sort of fighting this expense and return on investment battle as well. So let's talk about some maternally driven factors. So I'm going to separate this and talk about it from the maternal side, and then I'll talk about it from the sire side, and then we'll talk about it from the embryo side, because all of these sort of hold true for all of these different situations. So one is estrus. Even in fixed-time AI protocols, or even in embryo transfer protocols, right? The estrus response does indeed matter, right? We can get cows pregnant that don't display estrus, but at a lower rate. So we've worked with EstroTech for a long time. We've scored patches in this way, where the more rubs you have, the more estrus activity, the higher the score. We determined these to have no or low estrus and these to have estrus. We summarized a lot of data out of Brazil and out of the US, both in beef and dairy. And what you can see in the Brazilian data is you have this increase in estrus, you have this nice increase in fertility, versus in the US it's sort of flat here in these lower estrus responses, and then when you get into a full estrus activity, you have a higher pregnancy rate. So what we did, and then also the other thing to point out is you also have lower pregnancy loss. So fertility, if I ask someone in this room to define fertility, we'll have a bunch of different definitions, right? When you think about reproductive efficiency, you have to characterize it into windows, right? If a cow is pregnant on day 30 and she doesn't end up having a calf, she's not reproductive efficient compared to an animal that is pregnant on day 30, pregnant at day 100, and has a calf. But a lot of times we look at pregnancy rates and we forget to incorporate in pregnancy loss and what that means to our overall herds. Those animals that are losing pregnancy are probably the most inefficient ones that are in the population. So these animals that have lower estrus response have higher pregnancy loss both in AI and ET programs. And this is what those patches would look like. These were the old Estrotech patches, and then in collaboration with Boyd and the folks at Estrotech, we redeveloped the Estrotech patch based on this with this dot here, the breeding bullseye, which is a breeding indicator to basically take out the guesswork of when you've surpassed that estrus activity that's critical to basically get over that hump of fertility. And these can be used in a number of different situations that I don't have time to talk about, but sex semen, conventional semen, etc. Body condition score. One of the easiest things to measure in an operation that has the hugest impact, or a big impact in regards to fertility. Higher body condition scores, optimal body condition scores, having better fertility. Don't want cows too fat, but we don't want them too skinny. Getting them somewhere right in the middle is optimal, and no matter the data you look at, will have a strong impact on pregnancy rate, and in this case as well as estrus expression. You can see as we increase body condition score, we get an increase in estrus response. One of the things that we've done is we try to predict and follow pregnancy loss. So as a scientist, if you're working with pregnancy loss, once the embryo's dead, it doesn't do us any good, right? You're not going to wave some magic wand and have it come back alive. So what we need to be able to do is we need to be able to predict when these animals are going to lose. So I need to be able to look at a pregnancy today and say, yes, that pregnancy is good, but it's not going to live for 10 more days. And scientifically, let's understand why that pregnancy is going to die. That's what we have to do to increase our understanding of pregnancy loss, and it's a very difficult situation to do. What we do is we use pregnancy-associated glycoproteins, which are the marker for blood and milk-based pregnancy testing. And what we've shown in a number of studies now, and I'm not going to go into a lot of detail to this, but yes, we can predict pregnancy loss using these. We take a blood sample from a cow or a milk sample from the cow, and we predict whether she's going to maintain pregnancy or not. So this is the model that we use to study pregnancy loss, and some of the data that I'm going to show you and how we do that comes from this model, all right? And it comes from, we take a blood sample, we determine with very high accuracy, about 95 to 99%, whether that cow is going to have a successful pregnancy or not, and then understand from a physiological, biological role of how pregnancy loss is happening. So we believe that's how we're going to provide insights into sort of the pregnancy loss situation. The other thing is, just as Pete mentioned in his talk, breed has a huge impact in when we look at some of these aspects of reproductive efficiency. So Pedro Fontes and Cliff Lamb use this model of maintenance and restricted diets with both Angus and Brangus cows. So this is the effect of pregnancy loss in these two breeds. When you look at the cow breed itself, okay, these are the recipients, and you can see the red bar is the one that the animals are restricted, so they receive 70% of their maintenance diet. And what you see is those Angus cows, when we restrict them, they have a lot higher pregnancy loss to embryo transfer compared to the Brangus when we restrict them. So it shows you this effect of breed and nutritional restriction in regards to pregnancy success. When we look at that from the embryo side, so this is the breed of the recipient, okay, when we look at it from the embryo side and we say, what about the embryo itself, the breed of the embryo, how does that affect it? You basically see the exact same thing. These embryos that are produced from dams that are on restricted diets have a lot higher pregnancy failure compared to the Bos indicus breeds under the same influence. So there's an interaction of breed and diet composition when we look at this, and I'm not saying that everybody should go out and buy Brangus recipients, all right? That's not what I'm advocating here. I'm just showing the effect of breed and nutrition in the success of these programs. Also, temperament and reproduction, all right? So Reinaldo Cook, who's a colleague of mine at Texas A&M, has done a lot in this, looking at how temperament and reproduction interact. And basically, when you look at animals that are excitable compared to animals that have adequate temperament scores, you see this effect that you have decreased fertility in these excitable animals, right? Not surprisingly, the thing that always surprised me, when you bring the craziest cow that you've ever seen in your life to the chute, never fails, she's pregnant, all right? She did not read the book on this. That's not to say that crazy cows can't get pregnant. It's just to say on average they have decreased fertility and higher pregnancy loss. Now, one thing that Reinaldo has done here recently with a big group in Brazil, where we took recipients that were managed in dry lots, we took recipients that were managed on pastures. We kept those recipients in dry lots until the time of transfer, and then we kicked them out to pasture. The ones that were in pasture got transferred on, and they stayed in pasture. All right. And we looked at what the effect of pregnancy loss in those animals are from embryo transfer. And I'm just going to highlight it all down right here where it's red. These are the animals that we moved from dry lot to pasture, and you can see they had 47% pregnancy loss. You can see the different windows of pregnancy loss, compared to the animals that stayed on pasture the entire time, had significantly lower pregnancy loss in these ET programs. So really common situation in South America, and we're transitioning from the dry to the rainy season to manage the recipients in a dry lot and then kick them out after transfer, after pregnancy diagnosis. Real challenge to keep those cows to maintain their pregnancies for years. Looks like we're out again. Playing a role in basically those animals going out, learning how to graze, maintaining their body condition score, etc. So what about paternally driven pregnancy loss from the sire side? All right. Should I try a different one? Hold it on the top? Okay. Not sure why that matters. All right. So paternally driven pregnancy loss. So let me just ask you, if a cow loses a pregnancy or she's not pregnant at the end of the breeding season, what happens to her? She becomes hamburger meat. Is it her fault? Could be. What if it was a bad bull? What if it was a bad sire combination? What if it was a bad sort of genetic combination of the embryo? My point is that the cow gets the blame for a majority of pregnancy loss. And I jokingly used to say that I started to think about this because my wife told me everything was my fault, and I started to look at this from sort of the male point of view. How much is the male's fault in pregnancy loss? So if you look at normal sire fertility over lots of inseminations, these are 20 different sires that are all collected in CSS facilities. All their semen pass normal tests to basically pass all standards. But look at the range in fertility to fixed time AI. You don't want a bull 13 that has a 9% pregnancy rate. He probably is also hamburger meat now. Versus if you're bull 7 or 8 at 64% there, look at the range in all of these. So there's natural ranges in fertility based on sires. If we look at that in an ET program, okay, these are all embryo transfers. All right, so each of these bars represents an individual sire. All right, we have the day 30 pregnancy diagnosis, we have the day 60 pregnancy diagnosis, and then the blue line is pregnancy loss. What you see is that there's no relationship between initial pregnancy establishment and pregnancy loss. So bulls that have high day 30 pregnancy rates doesn't mean that they're going to have high or low pregnancy loss. It's all over the board. And this is important because this is critical in how we define fertility. If someone says a bull has good fertility, well, does he have a high day 30 pregnancy rate? Or does he have a high day 100 pregnancy rate or a high calving rate or what that might look like? So we have to think about how we characterize those because it has a big impact just by looking at this graph here. For example, look here at the end. There's a bull or a few bulls that have over almost 40% pregnancy loss between day 30 and day 60. So that means if you have 100 pregnancies on day 30, you're only going to have 60 by the time you get to day 60 of gestation. And it's a huge amount of loss. And this isn't unrealistic. This is what we see sometimes in embryo transfer programs. This is also to show you, so sire conception rate, SCR, is a measure used in the dairy industry. These are all dairy sires that I showed you here. Sorry, we don't have enough data in beef sires to show this. But this is just to show you that if you rank these sires by sire conception rate, which is a measure of their theoretical field fertility, there's no relationship, again, with pregnancy loss in SCR. So one, it tells us that we're measuring the wrong thing for SCR, which I think we have a good idea that we know that it's a large data system, that a lot of data goes into it. But two, it again comes down to the point of what does high fertility, what does low fertility mean? So I show you all that to show you different situations that we know affect pregnancy success, to show you some of the normal, to show you some of the things that we know have effects. But let's look at it from an embryo point of view. Okay, what are some factors that affect conception rates or pregnancy rates in embryo transfer? Well, we know there's a lot in regards to the embryo. I mean, everybody in this room or anybody that's been involved with embryo transfer that knows that we can get somebody to spend a lot of money on a donor, and we'll take good care of that donor, and she'll probably be way fatter than what she needs to be. But sometimes you go out and you look at the recipients and you think, wow, we're going to take those embryos that we just produced out of that high dollar donor and put them in those recipients. So sometimes there's not a balance between recipient management and donor management. That's one big factor. A lot of different factors from the embryo of the age, the stage, the source, IVF, in vivo, where they might come from, and then on the recipient side, the breed, the parity, the nutrition, the synchrony level, transfer technician, etc. So one of the things a number of years ago, Cliff Lamb put together a survey that he did with AETA, surveyed 218 members to rank their perception of factors that could potentially affect fertility in ET programs. And so 1 was the least impactful, and 5 was the greatest impact. So this is just survey data. So remember, 5 is going to be the embryo transfer technician thinks that's going to have the greatest impact in the success for a program. So if we just look through these here, CL diameter, for example, was somewhat low on the list at a 2.4 average versus body condition score at ET, about a 3.7, embryo technician, about a 4, embryo quality, so transferring good quality embryos, a 4. So if you just look through this list, I think we see a lot of the common factors that we discuss and have discussed already in this last day and a half in this meeting that are not only just factors that we talk about for success in an ET program, but are factors for success in any reproductive management program. So I want to show you a large set of data now to break down some of these factors. Just a large set of data from a group in Brazil. They manage about 7,000 recipients. They do about 200,000 embryo transfers. They do natural heats, estrosynchronized heats, etc. They sell recipients, and they sell weaned calves. Okay, so not something unlike what we would see in the U.S., but it's a really large set of data that I just kind of want to go through. So from 2012 to 2018, we had access to about 50,000 transfers. We looked at a number of different situations in this data. So this is the total transfer data, okay, so looking at IVF fresh, IVF vitrified, IVF direct transfer, and then conventional frozen. You can see how that gets to 51,000 transfers there. Most of them are going to be fresh embryos, but for the case of this, I just want to highlight a few things across here. So here's pregnancy rate by type of embryo on day 30. Again, remember this data is heavily influenced by the fresh data, so these don't have as much of an influence. Total overall pregnancy rates at day 30 were about 42% over these years of these data sets. If you look at embryo mortality across there and summarize it in a percentage form, about 8% across here. Keep this in mind because I'm going to show you when we start with 12,000 recipients, how many calves we get on the ground, right? So there's one thing to think about pregnancy loss, reproductive efficiency, but there's another thing to think about calves on the ground, and we'll look at that at the end. So you can see the breakdown across these of these different sort of embryonic mortalities. Here's pregnancy rate by embryo stage. Here's IVF fresh. You can look through here and see, these bars. Obviously, when we get into the blastocysts and the expanded blastocysts, we have slightly higher pregnancy rates compared to the morulas, and then the advanced or hatched blastocysts, which makes sense. So not unlike data that we would see out of the U.S. Very similar in the IVF vitrified embryos as well. Embryonic mortality broken down by stage of embryos. Across all these different stages from morula to expanded hatch blastocysts. You can see there's a little bit more pregnancy loss or embryonic mortality in these morula stage embryos as we get to more an advanced stage embryo. Some of this, you obviously are going to have a recipient interaction, ester synchrony, etc. So I'm just showing it by embryo stage here, so it's not taking into account that aspect as well. Type of semen used. Reverse sex sorted female, sex male, and then conventional. And you can see the pregnancy rates here across those slightly higher in the sex female, sex male, and conventional compared to the reverse sorted female. I will say that, and Luke made this comment yesterday, as the technology for sorting semen has gotten better, we've seen these increase quite nicely in these different areas, and so that definitely plays a role here as well when we look at this data. Probability of pregnancy by IVF lab. So if you've ever been to Brazil or ever read anything, there's IVF labs on every corner for cattle work. So this is 24 different IVF labs that they're sourcing embryos from. You can see the number of transfers. Each lab had to have at least 200 transfers in this data set. You can see one lab had 57% pregnancy rates on average compared to this one down here had 33%. So yes, lab does have an effect. Right, there's a lot of factors to talk about within that, from media use to handling, etc. But you can see the lab-to-lab variation in this data set right here, and you can see most of their transfers came from a single lab here with this number of about 8,000 transfers coming out of there. AI technician. One thing I didn't show you from the survey data is there was a technician in that survey data that had a 0% pregnancy rate from that AETA data. I'm not sure exactly how that happens, but that was in the survey data. So I'm assuming that person self-reported it, so I don't know if that's correct or not. Here's the technicians that they're using, 8 different technicians. Yes, you can see a 10% difference in what we would say is the best technician here compared to the worst technician. One thing that I always like to do is graph out the number of transfers that they've had. All right, because it's important to look at within a data set. Personally, when I go out and transfer, I find the cow that's in the best standing estrus, or she showed estrus and had a fully activated patch, and I try to pick the best embryo, and I just transfer one to maintain 100%. Right, so you can sort of trick the data and do that. These guys are transferring 15,000 embryos here. Right, so they're not doing that in this situation. Type of estrus synchrony with embryo. So these are natural estrus synchronizations here. This is fixed time embryo transfer. Just want to point out, fixed time embryo transfer here, 42%, pretty similar to the average that we're seeing across the board here. Yeah, the peaks on transferring on the day zeros or 7 days after or 8 days after, you can see are slightly higher compared to that. but still fairly acceptable pregnancy rates and over 7,000 transfers with fixed time embryo transfers. So the same concept as fixed time AI, where we transfer all the cows that have a corpus luteum 7 days after an induced ovulation. Size and side of the corpus luteum. These are CL grades 1, 2, and 3. So the ones are larger, and then you can see left versus right ovary. No real difference except these smaller CLs do have slightly lower pregnancy rates compared to the ones with larger CLs. This has been backed up by a lot of Doppler ultrasound data. Pedro Fontes has done some of that in the U.S. Guilherme Pugliese in Brazil has done a bunch of that to show that, yes, that is indeed the case. Those larger CLs have higher progesterone, have higher blood flow coming through them. So those are all factors, right? And I think that probably for a lot of you, there's nothing really sort of, extremely eye-opening about what I just showed. But these next few slides are what sort of keep me awake at night and keep me sort of wondering how can we increase our reproductive efficiency in ET programs, right? So how many pregnancies result in calves? How many embryos, if I start with this number of recipients and transfer this number of embryos, how many calves do I get on the ground? So I already showed you this. This is just a repeat of that. So this is a breakdown. So I took the 12,000, we took 1 year of data, 12,000 ETs, all right, and broke it down. Out of those 12,000 ETs, 3,018 calves were actually weaned. All right, so just think about that for a second. You tied up 12,000 recipients to get 3,018 calves. So let's break this down. So we started and we had 58% that were open from the initial ET. That's fine. The quicker we diagnose an open cow, the better we are and we can do something with her, right? So we can recover those, we can do something with them. And then if we start to just go around this wheel here, you can start to see where this pregnancy loss falls off, all right? So you have all this embryonic mortality. One thing that we're seeing a lot of now in IVF embryos is we're seeing a lot of loss between 75 and 150 days of gestation. What's driving that, we're not fully sure because the placenta is fully formed, right? But we're aware of that. We know that's going on. I'm going to show you some U.S. data here in just a second. That's a big impact into that. Then once we get these calves on the ground, you can see we've got a 25%, another 7% that we lost from calf death. And you end up with essentially 25% of the embryos that you started with resulting in weaned calves. So I encourage you to go home, pull out your ET data, and evaluate it. And don't evaluate it just for pregnancy rates. Evaluate it all the way to calves and calves on the ground, and look at what your success is. We have to do better than this. We have to do better than this. All right, and the programs are getting better, right? IVF programs are getting better. Now, if we look at this in some U.S. data, this is about 6,000 transfers, all IVF embryos coming from 3 commercial labs in the U.S. Broke it down by IVF fresh and IVF frozen. You can see the IVF fresh right under 45%, IVF frozen somewhere around 30-35%. Overall, if you combine all that data together, about 40%. If you look at pregnancy loss, you can see in the IVF fresh embryos, we're having about 15%. In the frozen embryos, about 20%. On average, across both of those, 17%. I think we can do better with that by basically, managing recipients in a better way, body condition score, managing estrus better, selecting better recipients, etc. Total loss to day 100, you can see here the IVF frozens somewhere around 28%, somewhere around 30% for those IVF frozens, and then overall you can see somewhere around 29%. And again, the thing that we're starting to over and over and over again see and hear about and have data on is these later pregnancy loss that are happening even after these time points. That will affect sort of that big pinwheel and how we break down pregnancy success. So with that, I'll summarize by saying that, one, it's amazing that we can generate an in vitro fertilized embryo, transfer it into a cow, and get the cow pregnant, and she have a calf, all right? The technology works. There's inefficiencies in the technology that I think all of us from a research point of view work on daily to make it better, but as we go through the system, biology is tricky, all right? Biology is built in a way that every time we try to circumvent something, we have something else show up, all right? And so the best sort of management of recipients, management of donors, and working with technicians that know what they're doing will maximize sort of the success to all of these programs. I'll thank the group of my students that do all the work so that I can give the talks. This was a few years ago when we were all happy outside of Kyle Field. Hopefully that happens again soon and we're not like the Florida State fans. And also want to thank all our funding sources and all the people that have worked with us throughout the years. And with that, I'll entertain any questions or comments.
Did you have conventional fresh embryos in that? If so, I missed what that was marked as.
Yeah, so they're conventional fresh, not conventional frozens in that large set of data. It's just a few embryos, it's not a lot in there. On average, the conventional fresh will be 10, sometimes 15% higher in pregnancy rates compared to the IVFs. Yeah. Other questions?
So if you're saying that there's going to be that much difference in the fresh versus conventional, why is it, the IVF versus conventional, why has it changed so much to IVF?
Yeah, that's a wonderful question. So one of the things that is driving that is the flexibility from a mating, flexibility from a donor use point of view. So, for example, a donor in IVF, she can be pregnant. We can do ovum pickup from her while she's pregnant. We can mate to multiple sires in an IVF setting. So you can take that collection from a cow. If she gives 60 oocytes, you can put 30 to one sire, 30 to another sire. The other thing is we can take conventional frozen semen. We can reverse sex sort it to make the desired sex. And then the other thing is over the last 2 to 3 years, there has been sporadic shortages of follicle stimulating hormone in the U.S., which have driven people shifting more toward IVF because of not being able to source FSH, situations like that. Now, with that, the topic that I didn't talk about at all, and we don't have enough time to talk about, is whether to use FSH in ovum pickup situations or not. The overwhelming data would suggest that FSH is beneficial in most cases to use it for IVF compared to not using it. So you kind of get back in the situation that you're still dependent on FSH. We just need a lot less of it in an IVF situation. But it's a really good question. I mean, if I had a choice and I owned the best donor in the world, if I wanted to maximize my pregnancy rates to her, I would try to make conventional embryos. But if I bought her or I had her in a time of the year and she was pregnant and I could still collect oocytes from her, I'm not going to abort that pregnancy to do conventional. I'll do ovum pickup and IVF. So it's a flexible sort of management strategy situation. And I think most really progressive folks are still using a combination of both conventional embryo transfer and IVF. Other questions?
Thank you, Dr. Pohler. Very nice. The IVF embryo attrition looks awful familiar to those of us that kind of survived the cloning days. And I wonder, do we have a very accurate mechanism to measure fetal embryo or fetal maternal communication, especially later in gestation?
Yeah, it's a really, really good question. We don't. The short answer is we don't. One of the things that we are seeing, I think, over and over again now in these IVF embryos is they seem to be at the right stage. they seem to be signaling to the cow that they're there. They seem to be starting to establish a pregnancy, but it's almost like if you take the Velcro situation, the ones that are surviving have a really intimate contact with the uterus. The ones that aren't surviving are basically very superficially attached to the uterus. And so, we've done a bunch where we collect these tracks at different stages, and I can almost predict when we open up the track, if the pregnancy just falls out, that when we look at the gene expression of those, they sort of match the embryonic mortality model, versus the ones that you sort of have to pull out. Those are ones that are sort of more competent. And, one thing, and Pete's done a lot of this work, there's a lot of machine learning work now being done to predict embryo viability based on different genetic patterns. And, in a beef situation, we have so many matings that are being made. And, you look at a donor that gives 100 oocytes, you might mate her to 3 different sires, and look at the variation of those 3 sires alone versus other donors that only give 5 oocytes and you mate to 1 donor. I mean, that's part of the, we still get 0% pregnancy rates sometimes, and we still get 100% pregnancy rates sometimes. The variation has decreased, but we still have failures along the way. And I gave this talk a couple years ago at AATA, and someone told me that your talk is very depressing. And it's not meant to be that. It's meant to be, I think about what we're doing, think about what we're measuring, and think about the small details that we can do a better job of. Because there's some things that we just can't control, all right? So if a specific mating of A and B, if you can't get one of them to stick, like that's somewhat out of your control, right? If every one of those pregnancies fails. Versus if I've got recipients that are in a body condition score of 3.5, I can managerially do something about that. And so I think that's the factors that we have to consider, and sort of how do we maximize that efficiency versus trying to minimize the risk that we have in other areas.
Let's thank Dr. Pohler.